So we have Rebecca with us today. So Rebecca is a great example of our classic weekend warrior. She tore her ACL while snow skiing in Telluride back in December. And she, of course, had some reservations about surgery beforehand. I think a lot of my weekend warriors do. We all have jobs, we all have lives, some of us have kids. So getting ACL surgery, sometimes we think that's for a teenager or a football player and not for us. So I thought she was a good case to share with you and show you that it's not so bad. And I wanted her to tell me a little bit about her experience.
So like you said, I tore my ACL and a few other things, snow skiing in December. Immediately knew I wanted to get it fixed, knew I couldn't just live with that, as active as I was. Did some research and, found the different options for ACL repair, replacement, and obviously wanted to have the best facility, and so tracked you down and was really just excited that I was going to, as far as I could tell, the best surgeon, the best place to go. And nervous about a surgery, of course, and when I asked you, should I have this surgery, your response was, well, it depends on how active you want to be, and so I knew right then and there I had to have it. So went into the surgery pretty nervous. It's surgery, so it didn't matter who was doing it. I was nervous, but surgery went great. It was, the first couple of days were pretty rough, as predicted. But 2 weeks of keeping it immobile and then going straight to PT. I was there, mid-February through the end of May, did physical therapy, and it was great. The therapists were really impressed at how quickly I was coming back. Like I said, physical therapy went great. End of May, we were done. Come June, I was hiking some pretty rough terrain with my brace, of course. And now, I'm done PT and I'm back to all of my normal activity, doing some pretty high intense workouts, running. In my classes, the instructors are always very concerned about me, and you might want to modify, but I go all the way, and they're just really impressed. Everyone has been like, they cannot believe I just had surgery 6 months ago. So
that's awesome.
At my age, I was really nervous about having the surgery done, but I could not ask for a better surgery, recovery, and like I said, I'm back to normal now.
That's awesome. Well, you've done a great job, and a lot of that's on you. I'd have you, Corey, let's take a look at her incision here. So you can see she had the hamstring ACL reconstruction, which is a fairly small incision, a couple of poke holes around her knee, almost invisible at this point, looking very good. And you can also see she's got her quad strength back, her legs are very symmetric now, which is another good sign. And let's go and look over at her pictures. First, let's go look at the injury. So you can see the ACL should be here. There should be a piece of tissue here. Here's the PCL in the background, and this is completely torn. So what we do is first clean out all the old ACL, and then you can see now we're cleaned up and there's just the PCL in the background. And then what we're going to do is drill a tunnel here, and we're going to reconstruct our ACL with our hamstring tendon. And what that looks like in the end is this. This nice shiny piece of tissue here is our hamstrings, and we've reconstructed our ACL with that. So again, it's the Weekend Warrior ACL. I thought it was a great example of how it can be, and she's done very well, and we're very happy, and we wish you the best of luck.
Thank you.